Ministers, like everyone else in the House, we welcome the public health advice that's now signalling, hopefully, transitioning out of COVID. And we will be asking the questions of what have we learned. And a couple of things I'd like to bring to that point. Antigen testing. We're going to have to figure out how we could not implement a public health measure for 15 months, which has shown its value in the last 3 months. Vitamin D, how we have ignored it, and I think a lot of science is going to point, again, a great health mission. And beyond that, the issue of HSE procurement, some of the dysfunctionality at it, but also some of, I would call it at this stage, really forcing down on indigenous contractors who engaged with the HSE, where now HSE are trying to derogate new terms because they see the COVID pandemic as passing. And this also includes companies who had antiviral drugs approved by the EPA and were not engaged with by the Department of Health at all. In terms of the hospital situation, we know we have significant waiting lists around the country, and I'd ask you, Ministers, you need to come up with a new strategy vis-à-vis the NTPF. And I'd also ask you, where is Sláinte Care at the moment? We know that National Community Care is trying to organise, but there's not a bit of evidence of it in the acute hospital sector. And when are we going to start to see that happen? In terms of my own hospital, and Minister Butler has left the chamber, but she's well aware we have significant deficiencies at UHW in terms of neurology, diabetes, dealing with trauma and dealing with general diagnostics, let alone trying to advance our 24/7 cardiac issue. So what I'm looking for is a forward development plan for University Hospital Waterford, a capital development plan, and I think that should be published for each of the other hospitals as well. So we try and see what is the plan that we are going forward with. In relation to residential care homes, we have a significant issue in recruitment, as you know, and in work permits. And the Taoiseach this morning advised that work permits could take up to 20 further weeks. And I would ask you, could we look at an initiative? Maybe there are people who are qualified in direct provision centres, and potentially there's an opportunity to get them out of there, to get them working for a short time, and to try to give them some points towards their asylum application based on that. They can be shadowed by other public health people. And Minister Fian, I heard you mention earlier in your opening address about the drug strategy. And I would ask you again to look at the support of drug strategy, particularly in Dublin. We will either pay now or we will pay later. It's as simple as that. And I would also ask you just to have a look at what's happening with opioid abuse in America. I'm sure you're well aware of it, but it is rampant now in American universities. And therefore it begs the question of where is education in terms of people actually using recreational drugs. I'd like to also reference the Frontline healthcare bonus. And as we know, there's a significant number of Section 38 and 39 workers who are excluded from this recognition bonus. I think that is a mistake, and I would ask you to revisit that. And I would also ask you, how are family carers and those that are looking after disabled in the home, how are they being demonstrated the social cohesion in terms of what they've had to do in terms of recognition of this bonus? I welcome the future National Mental Health CAMS review. We cannot operate hospital care without multidisciplinary teams, and we most definitely cannot do this for CAMS either, and I'm sure a new review will show that, and we need significant investment there. In relation to long COVID, I think we're going to have to start looking at setting up clinics around the country. There's ample evidence now of the effects of long COVID, similar to other post-viral syndromes. And people are going to have to be looked at, and we have to see, are we giving them the best care possible. And the last point I'd make to you, Ministers, is in terms of a proposed national COVID, be it a public inquiry or an expert review or whatever it's going to be. But I would ask you two things. One, is it going to be insiders or is it going to be outsiders who are going to lead this? And what lessons are we going to discuss? Because I think there's been a significant number of voices who have been left outside in terms of public health policy over the last 2 years. And if we want to have a full, frank and open discussion that is going to teach us anything, we have to allow other voices to be heard. Chair.